Hello everyone, my name is Kathy. A few classmates and I will be presenting on the disease tuberculosis. We will be discussing what causes tuberculosis, some of the risk factors, the signs and symptoms of both latent and active tuberculosis, nursing management, as well as community resources that are available in our area. We hope you gain a better understanding of this disease by the end of this presentation.
So what causes tuberculosis? Tuberculosis is an airborne infectious disease that is spread through microscopic droplets. An individual can become infected with tuberculosis when they ingest droplets through their mouth or nose from an actively infected person. An actively infected person can expel droplets from their lungs when they cough, speak, sneeze, sing, or laugh. The disease is contagious, but most likely, individuals will contract tuberculosis from a relative, coworker, or close friend rather than a stranger. Anyone can contract tuberculosis, however, there are some risk factors that increase an individual's chance of becoming infected. Having an already weakened immune system from factors such as HIV, AIDS, cancer, chemotherapy, severe kidney disease, organ transplant, diabetes mellitus, or substance abuse. All of these factors can put individuals at a higher risk of developing tuberculosis. Smoking not only increases the risk of contracting tuberculosis, but individuals with TB who are smokers are more likely to die from the disease. Certain occupations also put individuals at a higher risk for contracting tuberculosis. Those occupations include a correctional officer, certified nursing assistant, registered nurse, doctors, or homeless shelter volunteers. Another risk factor is traveling to areas of the world with drug-resistant tuberculosis such as Africa, Asia, and Latin America.
Signs and symptoms. According to CDC, a person with latent TB disease have no symptoms. Blood or skin test results are usually positive. A chest x-ray is negative, which is normal. A person with latent TB cannot spread TB to others, but should consider treatment for the infection to prevent TB disease. On the other hand, a person with active TB disease usually feels sick and can spread TB bacteria to others. Those will have a positive skin test or blood test which indicates TB infection. Will have an abnormal chest x-ray or positive sputum smear or culture, and will definitely need treatment to treat the disease. Those with active TB will usually experience these symptoms: a cough that lasts 3 weeks or more, chest pain or pain when breathing or coughing, coughing up blood, feeling weakness or fatigue, unintentional weight loss due to loss of appetite, night sweats, chills, and fever. Tuberculosis can affect other parts of the body. It can affect the kidneys, spine, or brain. If TB occurs outside the lungs, signs and symptoms vary according to which part of the organ is involved. For instance, if TB is in the spine, symptoms will be having back pain. If TB is in the kidneys, then a person may see blood in the urine.
My name is Nathaniel Soy. My slide I'm responsible for is nursing management, specifically in regards to treating tuberculosis. So nursing management for TB would involve various things, including testing, assessing the health history, signs and symptoms, diagnostic testing, and medical management. So for nursing management, you're gonna want to test the patient for TB. So there's different tests for that. There's the Mantel method, which is a standardized cutaneous injection, like a PPD. I'm sure we've all had to get some sort of TB testing for this program or for work, and generally that one is the one that I've gotten in the past, or I've given even the PPD one or the Mantal. Of course, that's the intradermal, the 15-degree with the bevel up, that testing like on your forearm. There's also the quantiferin TB Gold test, so that is testing an enzyme that would detect the release of the interferon gamma by white blood cells with when the blood of the patient with TB is incubated with basically it's matching it up to the organism itself, and then once that testing is assessed, if it's positive, look at the induration, you kind of feel over the site, 48 hours after, or depending on which is that the one-step PPD, the two-step PPD, whether regardless of what it is, of course, testing is first, and then again assessing the health and history of signs and symptoms, health history and signs and symptoms. So once a patient presents with a positive skin test, a blood test, or a sputum culture, you're gonna want to get, of course, patient's complete history, comorbidities, physical, assessment. Uh, like I said, a TB test, chest X-ray, drug susceptibility testing would be in order. Now, medical management for TB. Now, there's different kinds of TB medicine or TB medications. So pulmonary TB is generally treated primarily with anti-TB agents for 6 to 12 months. So this is assuming you're positive. And you're going to have a longer treatment duration to ensure, it's gone, organism is gone, and to prevent relapse. That's why it's 6 to 12 months. So there's primary drug resistance to one of the first anti-TB agents in people who have not had previous treatment. So there's different kinds. So there's primary drug, secondary drug resistance, multi-drug resistance. Currently, what they're offering these days for TB therapy, so for the 4 first-line meds are rifampin. These names are a little bit challenging to read. I'm not a pharmacist. Pyrazinamide, ethambutol. You have combination medications. The INH and rifampin, so that's combination of INH and rifampin, so that's rifamate. So those are other medications that you can use if you have TB. So recommendation or the recommended treatment guidelines for newly diagnosed cases of pulmonary TB have remained consistent since 2003. There's 2 phases here, so initial treatment phase and a continuation phase. So that initial phase, like I was saying, is a multi-medication regimen. INH, rifampin, pyrazinamide, ethambutol, vitamin B6. So all those are taken once a day in our oral medications. So then the second phase with that continuous regimen for additional 4 to 7 months. So that's going to be consisting of for patients who have they call it cavitary pulmonary TB. So that's if their sputum culture after 2 months is positive. And if the initial phase, so that all those combination meds, if those weren't successful, then they'll continue to that second phase of medication regimen. The main goal here for nursing management, specifically to nursing management, I kind of discussed a little bit about testing, assessments, diagnostic testing and the medicine. But the real, I guess, the NANDA part of it, like the plan or the goal, the nursing management, if you want to get very technical, would be promoting airway clearance, number 1, because this is a respiratory ailment or disease or issue we're dealing with here. Number 2, promoting adherence to treatment regimen, so that's making sure the patient is staying on plan as far as how to treat this TB. Number 3, promoting activity and adequate nutrition. So of course that's very important to you still want to be active and eat right in order to combat this condition. And number 4, preventing transmission. This is an um, airborne transmission of how this virus can spread, or this disease can spread. So number 1, promoting airway clearance. So very important with respiratory issues. So that's number 1 on nursing management. So with patients with TB, there's going to be a lot of secretions that's going to obstruct the airways. It's going to be hard to have adequate gas exchange or promote oxygenation in your body, because you have a respiratory issue that's it's hard to cough it up, right? You're going to be coughing a lot. You're going to feel uncomfortable, so that could affect your breathing and therefore your airway clearance. So some ways to manage that would be to instruct the patient to increase their fluid intake. So that's drinking more water, so pushing fluids. Of course, as long as it's with if the patient doesn't, of course, have fluid restriction, cardiac issue, on top of that. But we're not addressing that right now. We're just talking strictly promoting airway clearance. Let's just say they have TB. So that's be increasing fluid intake. What that would do is promote hydration, and it's actually a good expectorant. Help you cough easier, more productive in that way. To line the throat and the airway with water. And then of course positioning. So if you're in a hospital bed, if you're a patient, you don't want to be lying on your back supine, because it might be harder for you to breathe. So move the head of the bed up to facilitate the breathing to be easier. Semi-Fowlers or higher Fowlers, or they call it the orthopnic position if patient's really laboring to breathe. Number 2, so the next nursing management goal here, promoting adherence to the treatment regimen. So of course, this is just medication education, education on the disease process, talking about side effects, contraindications, drug resistance. Because there's going to be a lot of medication that they'll be on, like I mentioned before. So patients may not understand that. That's super realistic to see. So of course, educating on what the medication does, the side effects, when to take the meds, very important. Very important part of nursing is education. Telling the patient, TB is a communicable disease, and that taking those meds are most effective means of preventing transmission. So you need to take the meds to fight off TB. A lot of times, patients, they don't take their meds regularly, they're non-compliant, or they're just very lax with meds, or they don't like to take pills. Because people don't really like to take pills if they have a choice. Maybe they don't like the side effects, for example. That's the reason why treatment doesn't, they're not adhering to that regimen for those reasons. So the TB can linger, or it could just get worse. Patient doesn't improve because of it. So of course, education is important. Take meds on an empty stomach, or at least 1 hour before meals. Just so it doesn't interfere with absorption. Avoiding certain foods with certain medications, like INH, for example. Can't take anything with tuna, aged cheese, red wine, soy sauce. You could exacerbate some side effects, such as lightheadedness, palpitations. Avoiding alcohol with these medications, because it would hurt the liver. So that's a very important aspect, is education on the medications, the side effects, contraindications of those. So of course, drug resistance, if medication is not, taken consistently. Of course, you're going to want to monitor vital signs, check temperature, and explain to the patient how to detect your own temperature. Invest in a thermometer at home, blood pressure, respiratory. If they're breathing really easy, really hard, for example, that's something that you're going to want to educate on. Number 3, promoting activity and adequate nutrition. So a lot of times patients with TB, if they have chronic TB, they will they would have some weight loss. Maybe because of their illness, they're not motivated to eat. They feel weak. They lose muscle strength. They don't have appetite. So of course you're going to want to educate them on, you need to eat. You need to get a nutritional plan here. Small frequent meals, possibly maybe a strategy. Liquid supplements, ensure, just so they get enough calories in. And then of course increasing activity. Of course with the patients, how well they can tolerate activity. You want to try to promote activity. They say movement is a form of medicine, and patients' willingness to eat, like I was saying, can be altered by fatigue because they're coughing a lot. They have a lot of sputum production. So that's very important that you educate on. And lastly, preventing transmission. So that would involve, you got to teach the patient, proper hand hygiene, mouth care, disposal of tissues, kind of like what we're dealing with right now with COVID-19. Just not a lot of people really believe in hand washing. More, may not believe. Maybe that's crazy for us to think because we're in nursing, but you see that in the bathrooms when people don't. They just use the bathroom and they don't wash their hands. But yeah, so hand hygiene, explaining how to do that right, how important that is, because you could transmit this or transmit. Yeah, you can get this to other people. Another thing that is actually what I learned is the TB can actually spread to other parts of your own body if you have a TB. So it's called spread or dissemination of TB infection to non-pulmonary sites of the body is known as miliary TB. So this is a result of invasion of the bloodstream by the tuberculosis bacillus. So that's another possibility. So you want to inform the patient about that. So of course, making sure your whole body is clean. You're not, infecting other parts of your body. It's important to explain. So telling about fever, how to measure, like I said, measuring their temperature, and if they don't feel right, contacting your primary care physician. So then, of course, in that case, a chest X-ray is done to kind of examine if any of the TB has gone to other parts of their body, like the lungs, for example. So monitoring vital signs, of course, spikes in temperature, changes in renal and cognitive function, or something to manage as a nurse.
Community resources. You may be asking yourself, where can I get a TB skin test? Well, you have several options. One option is to contact your primary care provider to schedule an appointment. They typically offer this test and it's performed right there in the office. Another option is to contact one of the numerous community medical centers in the area, or contact the public health clinic. Again, if your primary care provider does not offer the TB skin test, another option is to visit one of the community medical centers or public health clinic. The community medical centers are federally funded and they do not turn anyone away. They offer discounts to those without insurance, as well as no-cost services for qualifying families that is based on income. Some of the locations are listed below along with their contact information. Please visit the link for more locations. To learn more about tuberculosis, please visit the links below.